Good evening, and thank you for taking the time to view this public service program. As Mayor of Bristol Borough, public safety is a major part of my responsibility. In viewing tonight's program, I hope you will have a better understanding of the challenges facing all of Bucks County as we work together to focus on the opioid crisis. Tonight's broadcast is part of our effort in the war against opioid addiction and as part of the Bucks County Blitz program being conducted throughout the county from April 14th to April 17th. This broadcast can be viewed daily from April 14th through April 27th on the borough's cable channel. I hope you take the time to share the info with family and friends. At this time, I'd like to introduce our participants in tonight's program. Bristol Borough Police Chief Stephen Henry, Dr. David Jaslow, Medical Director for the Bucks County Rescue Squad, and Mr. Scott Banner, who is the Chief of the Bucks County Rescue Squad.
Gentlemen, thank you. Chief Henry, Mayor, Dr. Jaslow, thanks for coming out tonight to discuss what we think to be a very serious public health problem that we're experiencing, not only county-wide and nationally, but as well as right here in Bristol Borough. In 2017, the Bucks County Rescue Squad responded to 209 overdose calls in Bristol Borough. 209. Of those 209, 122 residents or visitors of Bristol Borough were overcome by opioids. And of that 122, 16 people died that we know of, and it could have been more. But the whole problem with opioid is the addiction process of it. It truly is illness, and we understand that. And the illness itself doesn't affect just those that are addicted. It affects the entire family, and I think that's important. So I think it's fair to say that those with severe addiction aren't watching us tonight, but hopefully those that are will get something out of it, but also the family that are severely impacted as well. And I think that's what we can address tonight, some of those issues. Mainly that they didn't cause it. They certainly can't control it, and they can't cure it. However, what they can do is identify it. They can recognize it and start the process to recovery. And recovery is a very difficult process. Part of it is once you identify the problem that it exists, recognizing that their loved one is going to do things that truly they would never expect. Some terrible things. Addicted people will steal from their grandmother. They'll hurt their family members, hurt people that they truly love. Though it's not something they would ever expect from them, they've got to identify that as being part of the problem of the disease. And the disease can be treated. Success rate is difficult to accept, but it is a challenge that we have to overcome. One of the things that we've done in the local area is adopt a program called the Leave Behind Narcan program. And what that is when an individual calls 911 for a person that they suspect is having overdosed on opioids, if they meet the requirements to receive naloxone or Narcan, the paramedics will leave not only the Narcan with the person after they wake them up, with some information as well. And in this information packet is phone numbers and resources that they can use to get help if they so choose to do so. And that's all part of it. It's not just the quick fix of giving them the Narcan. It's recognizing the disease, recognizing the social aspect of it, and moving forward from there. Dr. Jaslow?
We certainly thank the Bucks County Drug and Alcohol Commission, which is one of the major organizations in this county that is supportive of everything that we're going to talk about tonight in terms of the opioid epidemic. The information in that packet comes from them. They have all kinds of resources that are available, not only for the persons who are addicted, but again, as the chief mentioned, this is going to be very dependent on family members. Most of what we find in terms of trying to seek care at whatever level for the addicted persons is that the addict themselves is reticent. They're the least likely to come forward and say, I need help. So it's usually a friend, a family member, a relative who is doing that on their behalf. I think we should also mention the great job that the Bristol Borough Police Department is doing, as well as the volunteer fire companies. We've all worked together to make sure that all the public safety providers in this municipality are trained in the administration of Narcan for an acute overdose situation. And even 5 years ago, it wasn't actually legal in the state of Pennsylvania for that to happen. So through enactment of changes to the law, and then through very aggressive education and partnering among all the public safety agencies, we're delivering Narcan sometimes in as quick as 2 or 3 minutes to victims of acute overdose. And while that clearly doesn't solve the problem, on a day-to-day basis, it's helping to certainly keep some patients alive so that we can try to get them into treatment.
And that comes down to, as we talked about, that partnership between public safety personnel, police, fire, and EMS, but we also got to throw in there the hospitals and their capabilities to not only extend the care, recognize that this person it may be reaching out and offer them the perspective of rehabilitation, which is where a lot of those other resources exist even locally, with the detox centers that are out there, and also the rehabs that are locally. Part of that whole process revolves around one recognizing, understanding that they can get help and where to go for it, but then those connections where the family helps to steer them in those directions. That road to recovery is important here when we have some fantastic facilities right across the street. So we have Gaudenzia and Lenape that sit right here on the campus of Lower Bucks Hospital. And we have the great resources through the county as well. But there's also a psychiatric services as a facility out of the lower portion of New Jersey, which we're familiar with as well. And all that information will be provided for the folks to see, where they can reach out and utilize those phone numbers and email address to get help.
So let's talk for a couple of minutes about what happens when emergency services contacts somebody in an acute overdose situation. It's not too dissimilar, actually, from what you see portrayed on television. So at some point, somebody recognizes an emergency. So certainly if you're a family member, a friend, or a relative of somebody that you believe is addicted to narcotics, to opioids, you want to know the signs and symptoms of what an overdose looks like, because in this case, overdoses can lead to the cessation or the stopping of breathing, and that obviously is immediately life-threatening. So you'd want to be able to recognize that emergency, dial 911, and then all of the following is going to take place. There's an immediate public safety response, and that would consist of, at a minimum, police and EMS, and in certain circumstances, including if there's information that the patient has stopped breathing or their heart has stopped. That's called cardiac arrest. That's a maximal response in Bucks County of police, fire, and EMS. So that's all coming to the location of the overdose. The patient will then be administered Narcan in addition to receiving support for breathing. It's usually by placing a bag and mask over their face with oxygen delivery and then other resuscitative measures. In many circumstances, the patient can be quickly resuscitated. They're then taken to the emergency department. And in the old days, what would happen is the focus would be completely on the physical medicine, that the overdose situation would be observed, the patient would get a bunch of tests, most patients recover, and then the attitude of the emergency department providers was, you're ready for discharge, good luck, I hope you get some help, see you later, and you literally get kicked out of the emergency department. And so there was no kind of assistance in terms of getting people into, emergency psychiatric care if they need that, or how to get into a detox center. Basically, the ERs didn't care. So in the last couple of years, there's been a very big push at the state and national level, and some funding that has been allocated to try to train emergency department personnel, physicians and nurses, how to recognize the need to get somebody who's been resuscitated from an acute overdose, and in particular, a narcotic overdose, immediately into treatment. And it's, as the chief mentioned, it's quite convenient that Gaudenzia is like 500 feet from the emergency department at Lower Bucks Hospital. You can't get closer than that. And that facility is the only drug and alcohol detox facility in Bucks County that is open 24 hours a day. So the idea, at least at this emergency department in town, is that every patient who's the victim of a narcotic overdose, an immediate intervention is conducted in the emergency department, which is a combination of ED staff and somebody from Gaudenzia literally walking over to the emergency department, somebody who is trained to do an intervention, and talking to the patient and saying, listen, We understand this is very traumatic. We understand that you're not feeling too great right now because we just wiped away your high, but we strongly encourage you to come over to at least have an intake evaluation, and we might be able to immediately place you into treatment services. And while that seems like common sense, why would you not do that? I'm telling you that several years ago that did not happen. So we're currently in a situation where this is a brand new treatment pathway. It's going to take a little bit of time to measure how successful it is, but certainly from a common sense standpoint, offering the ability to immediately sit down with a drug and alcohol counselor, somebody who knows the pathways to treatment, who knows what resources are available. You can get all the family members together at the same time who are interested in helping the victim. Certainly that should be looked at as a great opportunity to try to start the person on the road to recovery.
Which is all part of the conversation. If you think about it, it wasn't all that long ago where it was the hidden disease. Nobody talked about it. You know, why, and the question was asked, well, why do you go out there and you spend all this time, effort, and energy to administer this expensive medication to that individual? Why do they keep doing it? We're now starting to try to really grasp the idea that this is a disease of the brain. If you think about it, back in the 30s and 40s, cancer was a hidden crisis. Nobody talked about it. It wasn't discussed. Families kept it kind of quiet. And we moved that forward to even today. It's 2018, and we're just now really starting to develop the processes by which we can talk about it openly and treat it as the disease that it is, which that hasn't been the case for a very long time. So we're at the point now where we identify it as a disease. We just got to get the families to recognize it, and the friends to recognize it as a disease no differently than if it was somebody with heart disease and now they have chest pain. They know they're a diabetic and they're unconscious because they haven't had sugar. Recognize it as a disease for what it is. That effect on the brain is causing them to either do something that they wouldn't normally do, acting out, acting violent, or they're unconscious. Once we can kind of get the general folks to buy in on that, I think we can have an impact.
Yeah, and I think this is a great time for the three of us, the police chief, the EMS chief, and I, that we certainly want to get this message out to the borough, which is, I think all the residents look at us as we are the solution. The police chief should be locking these people up. The EMS chief should be curing these people with resuscitation. We are not the solution to this problem. We are dealing with the effect, not the cause. And this literally is a Band-Aid. You can put people in jail over and over again. You can send people to the emergency department over and over again. That does not solve the root problem of why drug addiction exists. And so we're happy to be a part of the solution. We're happy to talk about this. But certainly we cannot, through our agencies, affect the kind of change that is going to be necessary to decrease the incidence, which is a public health term that means how often do new cases occur. That is really not in our domain of trying to fix. I think, and the EMS chief and I just talked about this before we got on TV, I think we're now entering a period of time in this country where we have to change looking at this from the epidemic. Everyone keeps using the term epidemic. It's another public health term, which means a spike in incidence. It means a sudden increase in the amount of new cases that are occurring. And when people hear the term epidemic, the first thing that crosses their mind after they hear that is, well, this is short term. This is short-lived. Let's throw some money at it, throw some resources at it, literally throw some Narcan at it, and this is going to go away. That is not going to happen. We may actually be entering a period where this is now endemic. The term endemic means this is a disease that is going to exist forever at a certain level. And that level actually may be a very high level. The epidemic may not go away. This may be what we have to deal with for many months or many years. And so therefore we have to attack it like a true public health problem, which means it's going to take a long time to solve. It's going to take a lot of resources, of which the emergency aspect of this is like 5%. And it's going to take a lot of help from legislators, from other public health experts, and from family members.
Right. And then, as you said, Doc, there's a funding aspect of it. And there is a cost providing these services. And that cost, unfortunately, can be the lives of people that don't get what they need. But that comes down to the families, friends, relatives recognizing these problems and calling quickly, getting help to them as fast as they possibly can. Chief Henry, I know a few times we've from an EMS side, have encountered people who've asked about the medication that we carry, and are they permitted to use it? What if they find drugs on somebody? Are they impacted, or do they risk the potential for arrest?
Well, the legislature was smart enough to pass Act 139. Act 139 pretty much is a Good Samaritan Act. It pretty much takes away any criminal prosecution away from the individual that calls for help for that individual. So even if it happens to be two people that are in the midst of using heroin, and one of them goes into respiratory arrest, that person a lot of times is in a situation of, am I going to get arrested? Do I sit here and watch my friend die? Act 139 takes away that issue. When you call as the Good Samaritan, you are protected under that act. So we encourage people and users that when they're in that precarious situation, by all means, call us, call the emergency services, and we'll deal with it. But if that makes you feel any better, Act 139 does that. We talked about very early on about the partnership between the emergency service, the fire, police, and EMS, and how often we are dealing with this crisis. The Bristol Borough police officers in my 2 years here have saved numerous lives by the administration of Narcan. And it's very, very important that everybody understands that there's a danger to that, to the emergency responders. I mean, we're talking about this as a crisis, an epidemic, and everything else, but there's also another hazard that a lot of times the public doesn't realize, and that aspect of it is what we're doing to our communities and what we're doing to our first responders and the additional threat that they're up against with the cutting agents such as fentanyl and stuff like that. If an officer or a firefighter or an EMT comes in contact with that, they can just as easily go into respiratory arrest. I'm sure the doctor and you can advance a little bit more on that aspect of it, just how dangerous this stuff is, and to not be picking up these bags. It's brought us to a whole nother level when it comes to, we used to field test narcotics. We no longer do that because of the danger that it's putting our officers in. Canine officers are in jeopardy now, and our canine partners. This is called a blitz, the blitz that we're going to do for these 14 days. And I hope I'm not off base when I'm saying that it's a multiple pronged effect, just like the doctor said. You know, the police department are looked at as a law enforcement agency, and that's true, and that's 100% true. The Bucks County District Attorney's Office has taken a very aggressive stance with this lately. The establishment of the Bucks County Narcotics Task Force is in place. We work hand in hand with them. It's a very active group of law enforcement officers. And as much as we'll sit here and I'll give way to you gentlemen about helping and so on and so forth, and it's an epidemic and it's a problem, but if you deal or distribute narcotics in the borough of Bristol, we're coming after you. And that's a zero tolerance rule, and I know you guys are on board with that. And this, as the doctor said, is an unprecedented situation. In 34 years of law enforcement, being a narcotics officer, working in all those different jobs, heroin was a problem. Heroin was never to this extent. And it's almost, if you get beyond the opioids, is there something else that's going to take place? So the social aspect and the whole paradigm shift that's going to be required to solve this problem, I agree, is well beyond anything that the four of us are going to come up with. But I think it's real important, again, I'll just touch back on, again, that Act 139. Be very sure that if you're there to help somebody and you're in a situation where somebody is in an overdose situation, call 911. I'll tell a very quick story. I happened to find myself in a situation watching an individual in a parking lot in town acting suspiciously, and I called for another car. Myself and another officer approached them, and we realized what happened. His girlfriend was overdosing in the car, and he was panicking. Fortunately, we were able to administer her Narcan in time, and EMS arrived, because it was almost a full-blown CPR situation. And if this guy continued on his path, she would have died. So I think that's important for everybody to know.
Chief, I'm glad you brought that up, and it all comes back to this partnership. I think that the residents, and Mayor, you need to hear this. There is a fantastic working relationship within the emergency services. Of the 122 opioid overdoses that occurred in Bristol Borough, 81 of those times, police administered naloxone prior to EMS arrival. That's huge. That means that victim was medicated appropriately and breathing prior to EMS getting there. And when you start thinking about first responders and initial responders, it takes, on average, EMS to get on the scene of a call in Bristol Borough about 6.5 minutes. From the time that the call comes in is about 6.5 minutes. What we're finding is police is there about 2 minutes sooner, because you're on the street, you're closer, and that makes that time difference can be huge. Save brain, save somebody's life. So that's a credit to the chief, to the mayor, for allowing the police to follow the script of Act 139, which is what gives them the permission to administer a medication, as you very well know.
Time is huge. I mean, the substances we're talking about really need to be looked at in the vein of a hazardous material. These are patients, when they come to us, they're patients. On the medical side, they're injecting, snorting, they're putting toxic substances into their body, and what's worse is that many of them have no idea what it is that they're actually putting in their body. And some of the stuff, as the police chief mentioned, if there's fentanyl, carfentanil, the fentanyl derivatives in there, we're talking about substances that are so powerful that they will shut your breathing down to zero in less than 1 minute.
Carfentanil is used on rhinoceros.
Yes.
It's crazy.
So the stuff is dangerous. It's a bad mix of factors. We have a bunch of young people who feel that they're invincible, who don't understand the risk that they're taking. They're using substances that they have no idea what they are, and they can't figure it out because they're immediately unconscious. And if there's not somebody there to notify 911, that actually ends up where a lot of the deaths come from, is that if you overdose by yourself, that's another independent risk factor for death because nobody can find you.
And Doc, you'll remember this, and Chief, I think we had this conversation. Mayor, we held an interesting conversation on the idea of an overdose, right? So if you have a headache and you take 2 Tylenol, you took 2 Tylenol for a headache. If you take a whole bottle, you overdosed in Tylenol. If you take, because there's a normal dose for that Tylenol, when you take heroin, we call it an overdose, but what is the dose of heroin?
Right. There's no normal dose of heroin.
Right. There is no normal dose. So you're poisoning yourself with heroin. No different than if I were to drink diesel fuel. I'm not overdosing on diesel fuel. I'm poisoning myself with it. And I think that's kind of the twist that people have got to look at is these have very, very negative consequences on the human body and on the cellular level. That the consequences can be huge. And just with the partnership in the first responder community, getting these life-saving medications on the scene, having the family recognizing the problems quickly, can truly save somebody's life. But it all comes down to what happens next. Giving them this medication, helping them breathe now, isn't the end. It's just the very beginning. It's like a rebirth. It gives them the opportunity to seek what they really need, which is the detox and the rehab and then further recovery down the road. Doesn't end there. It's just the beginning.
Let's quickly mention, everybody, this Leave Behind Narcan program. This is designed not for the addict, not for the patient. It's for the family or somebody that lives with the person, right? Because if an individual is going to ingest fentanyl or heroin and suddenly become unconscious, by definition, they're not conscious or awake to give themselves the antidote. So the antidote is not for the person, it's for somebody else who's with the person to administer. And so that means that if you're a family member or a relative who's concerned about somebody who's an addict, you must get involved because you're the one who the Narcan Leave Behind program is designed for.
If you think about it, you can walk almost any store, any mall, any airport and find an AED. They're all over the place because of the potential for cardiovascular disease and heart attack. This is going to become, Narcan is going to be that next movement, having this stuff everywhere just because of the prevalence of opioid addiction. And by the way, it doesn't just affect humans. It have a profound effect on the pet world as well. Your family pet can be overcome by dirty needles that are laying around and drug paraphernalia that's left on the ground. If they eat it, absorb it, they too can be impacted by the opioids. Be very careful with children in the house too that tend to pick stuff up, specifically little baggies. You know, you might know that you have a relative that uses the drug, and whether you agree with it or not, if they leave those bags laying around, it can be absorbed by the skin of the child that picks it up.
Or
So-
even pills, especially if people are addicted to Percocet or similar kind of medications, and wherever they're getting it, if they're getting off the street, which means it's not in a marked pill bottle that a child might come to understand, I shouldn't be touching that, and they don't know what it is, and they put it in their mouth. And the smaller you are, the younger you are, the faster you can be overcome by these drugs.
And the same with health-related issues. If you have underlying heart disease, you want to be careful with touching this stuff as well. Which brings us to the conversation of what to do with it if you have it and you find it, you want to get rid of it, including prescription drugs. Please don't just flush this stuff down the toilet or throw it in a garbage bag and throw it away. There are appropriate dispensers that are abound usually in municipal buildings where this stuff can be secured appropriately and destroyed by the county. So it's something very important to not just throw this stuff
We've
away.
been part of the drug turn-in program over, I guess, the last 4 or 5 years.
It's Operation Take Back,
Right.
and give me a minute, I'll get you the next coming date, I believe.
Where not only in Bristol Borough, but all the municipalities that are participating in it, that you'll come in on it. It's generally on a Saturday. We have an officer here, no questions asked. You bring it in, put it in a secure box, and we take care of getting rid of it.
So folks, please take advantage of those opportunities to get rid of it. Get it out of your house. You don't have to risk a friend or a relative or somebody that you truly care about being exposed to this stuff, or inadvertently exposed to it by the garbage man picking it up or some child going through the garbage can.
I believe it's April 22nd, but I might be wrong on that. But it's Operation Take Back. It's held by the DEA, Drug Enforcement Administration, and the Bucks County District Attorney's Office. And Matt Weintraub is a big push on that. We'll be advertising that on our website, both the police website and also the Facebook page of the borough, and other ways to get it out to the public.
The last thing that I'll say on this, and just as a reminder and a recap of what I said earlier, addiction is a disease. It's a disease of the brain that affects the entire family unit. The 3 C's are so important for the loved ones. They didn't cause it. They certainly can't control it, and they can't cure it. The only thing that they can do is recognize it, provide all the love and support they possibly can, and get them help. That's it. That's the home run. Understanding those 3 kind of areas of concern, finding a place where, and by the way, failure in recovery is part of recovery. Those that are in recovery will fail. They'll fail multiple times before they get it right. Find the right mix of medication and the appropriate therapy. So
I think it's important, Scott, to also say that, especially for our viewing audience, because I think we pretty much know most of the people that are watching out there tonight, let's try to stop to that progression before we get to that point. Know what your children are doing.
Yes.
Know their coping capabilities. We're finding more and more that our young people today have the coping mechanisms that our earlier generations did. And because of social media and other social pressures on our young people, they're very quick to jump to feeling better somehow through chemicals, in this case, opioid addiction. So the more you're involved with your children, the more you're paying attention, the more you know your friends, the longer they're going to be safe. So I would just beg you to do that, if nothing else.
I completely agree. Gentlemen, thank you very much for having us today. I think it was an extremely important topic to discuss.
Thank you.
Well, I hope it was an informative half an hour for you tonight. On behalf of Scott Bonner from the Bucks County Rescue Squad, Dr. Jaslow from the Bucks County Rescue Squad, Police Chief Steve Henry, myself, and the Borough Council, we want to thank you for taking the time to watch this program, and I hope you've really gained some information that will help you on a daily basis. Thank you and good night.